It's the holiday season and a period of time when people are thinking of gathering with family, friends, and loved ones. But this year might be a little bit different for you. This year, you're thinking about creating your own family, but you're struggling with infertility. Hi, I'm Coach Dr. Manju. I'm the creator of the course Fertility, Wisdom, and Wellness. You'll be hearing more about this course in a couple of days in another video. Some of you know me from my blog, some of you have seen my Facebook page, and some of you have been referred to me. So how are we all doing right now in this very moment? Let's just take a few seconds to get centered. You may be feeling many mixed emotions right now. Some of you may be happy, but if you're not happy, don't worry, you're not alone. You may be confused, you may be sad, you may be overwhelmed or depressed. And I understand how frustrating dealing with infertility can be. A couple of days ago, I sent a message out to some of my followers. I was asking about what topics with regard to fertility that you'd be interested in. And I got an overwhelming response that told me that many of you were interested in how to stay healthy because you're undergoing in vitro fertilization or undergoing an intrauterine insemination this holiday season. I recommend starting to prepare for IVF or IUI about 3 months prior to the procedure. But if you just don't have that kind of time, then I suggest that you take away whatever you can from this video and start implementing some basic things right away. I think you'll find that there are some simple things that you can do that will maximize your chance of success. The first thing that I'm going to talk to you about is diet. Studies have shown that diet strongly impacts fertility. There is a famous study called the Nurses' Health Study that was done by George E. Chavarro from the Harvard School of Public Health. And this study examined the behavior of over 18,000 female nurses, and it uncovered some vital information that I'm going to share with you. You can also buy his book on Amazon. It's called The Fertility Diet. The first thing I recommend is to eat whole organic food that is devoid of pesticides and genetically modified foods. You'll see the label when you go to the grocery store, GMOs or genetically modified foods. And these foods are extremely toxic to the cells of the body and the cells of the reproductive system. The next recommendation is to eat complex carbohydrates. Carbohydrates are turned into sugar or glucose by our digestive system, and insulin, a hormone produced by the pancreas, is secreted to promote the uptake of this glucose by our cells. Slowly digested carbohydrates take longer to turn into glucose, which causes a slower rise in insulin levels. Pasta, white bread, cookies, cakes, chips, and white potatoes are rapidly broken down into glucose, causing a sharp rise in insulin levels. Over time, these sharp rises cause elevated insulin levels and elevated blood sugar, which can lead to prediabetes or diabetes. Prediabetes and diabetes cause hormonal problems and ovulatory problems. Increased insulin levels disrupt normal ovulation and can affect egg quality. Next, I'm going to talk to you about eating whole grains. Whole grains are great for you. They're high in fiber, and fiber is good. It keeps you full, it regulates your bowel habits, and can lower cholesterol. Avoid refined products made with white flour. Now, I know that everybody is on a low-carb diet these days, but some carbohydrates are good for you and can be beneficial to you. I would caution being on an extremely low carbohydrate diet while trying to get pregnant. Next, I recommend eating protein. I recommend eating protein with every meal. If you're going to eat meat, I think that it should be free-range meat because it is devoid of hormones. Protein is extremely important. It's the building block for all of the cells in our body, especially the cells of our reproductive system. A great source of protein is bone broth. Try bone broth. It's rich in amino acids and very nutritious. Next, I'm going to recommend eating good fats such as avocado, nuts, and coconut oil. The topic of dairy is quite controversial. Some people suggest avoiding or eliminating dairy completely from the diet, And the Chavarro study actually suggested that full-fat dairy in moderate amounts was actually okay. I think the 80-20 rule applies when it comes to dairy. I think having full-fat dairy once in a while in a small amount is fine. I recommend banning trans fats from your diet. Unfortunately, it doesn't take much trans fat to have a harmful effect. Even a few grams per day has been linked to increased risk for type 2 diabetes, insulin resistance, cardiovascular disease, and inflammation. Next, I'm going to talk to you about supplements. The following supplements can enhance egg health and enhance egg quality. Take a good multivitamin. The B vitamins are important for your immune system and egg health. Vitamin B12 is important in maintaining the lining of the uterus, which is necessary for healthy implantation of the embryo and is important for ovulation. Vitamin B6 helps with easing morning sickness and correcting low progesterone levels. Normal progesterone levels help maintain the pregnancy, thereby preventing miscarriage. Vitamin C is an antioxidant that regulates sex hormone balance and specifically mitigates low progesterone levels. Zinc is vital for egg production, normal follicular fluid levels, and hormonal balance. Iron contributes to healthy ovulation and overall health. Another very important supplement is folic acid. I recommend the active form of folic acid called 4-methyl tetrahydrofolic acid. I know those are big words. It's all written in the handout below, so if you forget any of what I'm saying, you can always print this out. Folic acid is extremely important. Studies have shown that folic acid decreases the risk of neural tooth defects and also decreases the risk of Down syndrome. Folic acid is found in green leafy vegetables. Take a look at this slide and realize all the different sources that exist of folic acid. Next, I'm going to talk to you about vitamin D. Vitamin D is vital for female hormone production and ovulation. Vitamin D has also been associated with IVF success rates. Exposing yourself to sunshine for 20 to 25 minutes a day not only makes you feel good, but also boosts your vitamin D levels. Hey, no sunscreen allowed. Vitamin D is found in butter, eggs, salmon, tuna, cheese, mushrooms, and fortified milk and cereals. Many people are deficient in vitamin D, so have your level checked and take supplements as needed. Avoid oversupplementation though. It might have the opposite effect. Next, I'm going to talk to you about a very important supplement, coenzyme Q10. Coenzyme Q10 provides fuel for the mitochondria in your cells. The mitochondria are the generators of energy inside your cells. This energy is needed to make healthy, properly functioning eggs. Thus, coenzyme Q10 is taken to improve egg quality and possibly egg quantity. Coenzyme Q10 has been shown to increase mitochondrial activity in a study done in Canada, where mice were given ovarian stimulation. Ovarian stimulation is medication to produce multiple eggs during IVF. The mice that were given coenzyme Q10 produced better quality eggs and more eggs. The human egg is one of the largest cells in the human body and has more mitochondria than any other cell. The production of a healthy human egg requires a tremendous amount of energy. Coenzyme Q10 has also been shown to improve pelvic blood flow and increase success rates in IVF. Low levels of coenzyme Q10 have been associated with miscarriage. Next, I'm going to talk about omega-3 fatty acids. Omega-3 fatty acids are powerful anti-inflammatory agents. What can omega-3 fatty acids do for you and your baby? They reduce the risk of preterm labor. They positively affect development of the fetal brain and nervous system. They increase blood flow to the uterus. They increase the production of cervical mucus. They keep sex hormones balanced. They are instrumental in maintaining healthy fetal birth weight for the baby. They boost your mood. And they reduce the risk of a condition known as preeclampsia. Preeclampsia is known as pregnancy-associated high blood pressure. This can lead to seizures if left untreated. Before thinking about getting pregnant or before going for in vitro fertilization, it's important to have certain lab tests. Go to your doctor and get a full checkup. First of all, ask your doctor to test you for anemia. Research shows that women who are anemic decrease their chance of pregnancy by about 60%. Also ask your doctor to do a full thyroid checkup. Thyroid hormone deficiencies strongly affect fertility. Thyroid deficiencies lead to menstrual irregularities, inability to ovulate, miscarriages, inability to get pregnant and maintain the pregnancy. While you're pregnant, they can also lead to poor fetal growth and premature births. Lastly, I recommend a few more things. Ask your doctor to check you for diabetes, get a pap smear, and get the flu shot. IVF is extremely expensive. You do not want to get the flu during this procedure. Stay well hydrated during IVF. I really recommend avoiding alcohol and multiple cups of coffee. Also, avoid plastics. PBA, a chemical found in plastics, has been linked to infertility. PBA can be found in water bottles, canned foods, packaged foods, and plastic containers may contain PBA. Now I want to talk to you a little bit about stress management. Because IVF is an extremely stressful procedure. You paid a lot of money for this, so you want to make sure that you have a good outcome. And having high stress during this procedure is not going to give you a good outcome. One of the things that you can do to relieve your stress is acupuncture. Not only is acupuncture extremely relaxing, studies have also shown that acupuncture increases IVF success rates. Other stress management techniques are meditation and yoga, massage, stretching, sleeping well, hypnosis, and counseling. If you found this information useful, you may want to sign up for my upcoming course, Fertility, Wisdom, and Wellness. I think it's going to be a great course. We have some great bonuses and some great guest speakers. If you enjoyed this video today, scroll down and leave a comment for me. And stay tuned for more details about my upcoming course in the next video, which will be coming out in a couple of days.